Hello everyone, welcome back to Target Nursing Officer. So this is class 3 of our nursing MCQ series. So in today's class, we will practice important and high-yield MCQs that are very useful for NORCET, AIIMS, ESIC and other nursing exams. So try to understand each question before the countdown ends and don't forget to comment your score below. If you find this video is helpful, please like, share and subscribe to my channel for daily nursing exam preparation. So let's start today's class. So in previous class we have completed 50 MCQs. So today we'll start from question number 51. So the question is, the child has a complete set of deciduous teeth at, the options are 1 year, 2 year, 3 year and 4 year. So the correct answer for the question is option B, that is 2 years. Okay, so next comes to the question number 52. If 5-year-old male child is likely to perform which of the following? So again I repeat, if 5-year-old male child is likely to perform which of the following? So the options are tie shoelaces, ride a bicycle, paddling a tricycle, the broad jump. So for this question the answer is option D, that is the broad jump. A 5-year-old male child can likely to perform the broad jump. Okay, so next comes to the question number 53. So identify the 3-letter printed material to letters and words and can print letters. He may be a 2-year-old child, 3-year-old child, 4-year-old child, 6-year-old child. So for this question the answer is a 6-year-old child. So for this question that 3-letter printed material to letters and words and can print letters, so it can be done by a 6-year-old child only. Okay, so next comes to the question number 54. So which are the two fast permanent teeth appear following the deciduous teeth? So the options are central incisor, lateral incisor, molars, premolars. So for this question the answer is molars. Okay, so after after the deciduous teeth, the first permanent teeth appears, that is molars. Okay, next comes to the question number 55. Okay, delayed indentation is an important characteristics of, options are hypothyroidism, hyperthyroidism, malnutrition and rickets. So for this question the answer is hypothyroidism. Okay, so next comes to the question number 56. So the mature pincer grafts is attained by age of 8 month, 10 month, 12 month and 18 month. So the correct answer is 12 months. So at 12 month the mature pincer grafts is attained. Okay, so next comes to the question number 57. So voluntary palmar grafts appears at what age? So the options are 28 weeks, 20 weeks, 12 weeks at birth. So the correct answer is 20 weeks. Okay, so as you know the palmar grafts reflex, also known as involuntary palmar grafts. Okay, so it is an involuntary response to a mechanical stimulus that is present in newborns. Okay, so palmar grafts usually appears at 16 weeks. Okay, of gestation and disappear around 3 to 4 months. It is also a question that comes in every exam. So when the palmar grafts disappear, the correct answer is 3 to 4 months of age. So next comes to the question number 58. So identify the correct statement related to milestone achievement in child. The options are running is seen at the age of 15 months. Then option B, 1-year-old child speaks 2 words with meaning. Option C, recognizing mother is seen at 3 months of age, and all of the above. So option B, it's a little bit typing mistake. So here that option is 1-year-old child speaks 2 words with meaning. So at the age of 1 year. Okay, so for this question the option A is a correct statement, and a 1-year child can speak 2 words with meaning. It's also a correct answer. So correct statement. Then option C, recognizing mother is seen at the 3 month of age. So it is also a correct statement. So for this question the answer is option D, that is all of the above. Okay, so next comes to the question number 59. So when Rajan was 3 months old, Okay, he did not search for a hidden toy. And at 9 months, he looks for it and reflecting the presence of. Okay, once I repeat this question, so you try to understand. So when Rajan was 3 months old, okay. So when Rajan was 3 months old, he had a toy train. Okay, so when he view of the train was blocked, means he did not search for the hidden toy or train, and at the 9 month he looks for it again. When he achieved 9 month, that time he again search for the toy. Okay, so these characteristics or these milestones reflecting which statement, which options is correct for these questions. So the options are: first one is object permanence, option B sensory motor play, option C schemata, then option D magical thinking. Okay, so for this question the correct answer is option A, that is object permanence. So why? As you know, the Jean Piaget, he described the object permanence, that meaning that the objects continue to exist even when they are not visible. So it develops during the sensory motor stage, that back to 2 years of life. Okay, and it is usually appears around 6 to 9 months of age. So when a baby searches for a hidden toy, it shows that the baby knows the toy is still exists. So that's why the correct answer is for this question is object permanence, because the baby know about the toy at the 3 month of age, then again he forget about that toy again at the 9 month of age, he again looks for it. So that's why it is it reflecting the object permanency. Okay, so next comes to the question number 60. So a baby with tripod position, then bidextrous approach recognize the strangers and can spell monosyllable word by the age of 7 month, 9 month, 10 month, and 12 month. Okay, so the correct answer is 9 month. Okay, so the baby can spell monosyllabic words by the age of 9 month. Okay, next comes to the question number 61. So identify the correct statement related to milestone achievement in child. Okay, you have to identify the statement which are correct. Okay, so the options are: sit without support at 8 month. Okay, then option B creeping at 9 month, then stand without support at 12 month, then all of the above. So for these questions, the correct answer is option D, that is all of the above. Okay. So you know that sit without support is appears at 8 month of age, then creeping at 9 month old appears, then stand without support that achieve in 12 month of age. So that's why the option D is the correct answer. So next comes to the question number 62. So at what age child can eat food without spilling? Then identify gender and say full name and dress self with supervision. So again I repeat this question, so listen carefully. So, at what age child can eat food without spilling? Okay, then identify the gender, say full name, and dress self with supervision. So the options are 2 years, option B 3 years, option C 4 years, and option D 5 years. Okay, so the correct answer is for these questions option B, that is 3 years. So 3 years baby can eat food without spelling, then identify the gender and say full name and dress self with supervision. Okay, and without supervision, then he 5 Okay, dress and also undress. So next comes to the question number 63. So the question is: when assessing physical development of a 5 years old child, which is abnormal? Okay, so the options are: walks upstairs one step at a time, option B catches large rubber ball, option C stucks 6 blocks, and option D jumps on one foot. So the correct answer is for these questions, that is option A, that walks upstairs one step at a time. So as you know, a 3-year-old child should be able to walk upstairs using a reciprocal pattern, placing one foot on each step without requiring the use of railing for support. Okay, then you know that at the age of 4, then the child should be able to go both up and downstairs using a reciprocal pattern, and no rail needed. Okay, means railing, the side rail is not needing railing. The other mentioned milestone are expected in a 5-year-old child, but the option A is not a normal sign for a 5-year-old child. So that's why the option A is the correct answer. So next comes to the question number 64. So toilet training should be initiated at 15 month, 18 month, 20 month and 24 month. So the correct answer is 18 months. So at the age of 18 months, so the toilet training should be initiated. Okay. So next comes to the question number 65. So child can withhold bowel movement at the age of. The options are 1 year, 2 year, 3 year and 4 year. Okay. So the correct answer is 2 years. Okay. So the child, a 2-year-old child can withhold bowel movement. Okay. Then comes to the question number 66. So treating dolls as living is an example of. The options are logical reasoning, option B egocentrism, option C concrete thinking, option D that is animism. Okay. So the correct answer is for these questions animism. Okay. So the word animism meaning, so when a child thinks that toy or objects are alive. Okay, so that is called animism. Okay, so animism mainly described in Jean Piaget's theory. So examples are talking to a doll, means a child developed that talking to a doll, thinking a teddy feels pain, then believing the sun or moon is alive. So these things are coming under the animism. Okay, treating non-living things as living. Okay, so I think you understand what is the meaning of animism. So next comes to the question number 67. Okay, so according to DDST, infant stands with support at. So can you guess? I think you will guess the what is DDST. So Denver Developmental Screening Test. So, according to Denver Developmental Screening Test, an infant normally starts standing with support in the options are 6 months, 9 months, 12 months, and 15 months. So, the correct answer is 9 months. Okay, so a infant stands with support at the age of 9. Okay. So mainly that standing with support is a gross motor milestone. Okay. So DDST is a training tool, as you know, that used to assess the child's development from birth to 6 years. Okay. So that's it for today's class. So revise these questions once again, and if you found these classes are helpful for you, then please don't forget to like, subscribe and share my channels. So thank you for watching Target Nursing Officer. So see you in next class.